My name's Deborah Zielinski. I'm an optometrist from Chicago, Illinois. I'm here to discuss the current military vision screenings and how an enhancement to them can enhance the performance on a battlefield. I have no disclosures except a thank you to Babak Kateb for being such a visionary, no pun intended. The main point I want to make is that 20/20 is not enough. The eye is connected to the brain. It's actually a part of the central nervous system, and changing the eye changes brain function, and brain function changes body function. The problem is that on a battlefield, there's demands for many different visual skills, quick and accurate processing. And the current military testing assesses eye health, eye movement, peripheral and central eyesight. However, the testing is done with patients seated, and it does not include how peripheral and eyesight act together as a team. So the hypothesis that sudden small movements will trigger changes on the peripheral retina, which in turn stimulate internal reactions, stressing the nervous system. So the patients that we see who have customized eyeglasses to balance out peripheral and central systems end up with increased comfort and heightened spatial organization ability when wearing those glasses. Modifications of the standard visual examinations to mind-eye examinations allow for enhanced performance. The modifications include the patients moving and having moving targets and changes in luminance. By doing that, people on a battlefield will have better decision-making, improved reaction time, and a less stressed nervous system. When I tested ROTC people for vision screenings, I was surprised at how many people had 20/20 eyesight and were told they didn't need glasses, yet still had imbalances between their peripheral and central eyesight processing. There's more issues than eyesight can be addressed with glasses. The modifications to the testing would be very inexpensive, very quick, and have significant impact on survival skills. When you talk about the retina, there's three main visual inputs, and they combine. There's one from the target. Here in this case, it's a horse. There's another one that would be the background. In this case, it's the grass. But there's a third one, which is ambient lighting. And the ambient lighting signals are, depending on the luminance, affect a third photoreceptor cell. There's rods and cones, which were for years and years thought to be the only eyesight components, the only things reacting to light. And the third component is called an IPRGC. It's a special cell that reacts to the ambient lighting. Meanwhile, instead of just the three signals going into the brain, there's also signals coming back from the body into the eye. And those signals coming back from the body into the eye are determined by the body, how the person is. So for instance, if you're depressed, you will tune out some of your peripheral sensors. If you have anxiety, you will hypersensitize some of those peripheral sensors. The peripheral sensors are crucial. For instance, if a mouse were running across the floor, all it's creating is a shadow on the edge of the retina. Yet that shadow is creating internal reactions of muscle tension and stress and cognitive attention shifts, as well as adrenaline rush and heart rate increases. Your whole autonomic nervous system is affected just by a shadow on the retina. Yet, in regular eye examinations, because over 80%, almost 90% of the retinal sensors are in the fovea, the center, that's what the 20/20 comes from. That's what's tested. And all of the peripheral sensors are not tested as well. The peripheral eyesight is actually blocked off during conventional testing. Conventional testing does test, do you have peripheral eyesight, but not whether it's used, and not how it links with the central eyesight, not how it's affecting other systems such as adrenaline. The retina in the last few years has been evolving. The testing is evolving. There's been studies that have shown that the nasal retina is different from the temporal retina, that's different from the superior and inferior retina. In fact, they are finding that if you shine light onto the nasal retina, the biochemistry in the body is totally different than light shined onto the temporal retina. There's different mind-eye pathways. Light entering the eye has the classic what is it identification pathways, as well as localization, balance, and chemical pathways. In general, the retina is an interface between external and internal systems. The visual pathways register external information, and the non-visual pathways register internal information. There's this gap that exists between neuroscience and eye care. And with collaboration, we can do research filling that gap. There are 63 million photosensitive receptors, and they filter down into 1 million exiting signals into the brain. Every person reacts differently to those signals. And when they aim and focus on a target, there's interaction between what's going on in their mind and what's going on in the outside. Think of that mouse example. What if the mouse were carrying a hand grenade on a battlefield, and now the soldiers seeing a hand grenade out of their corner of their eye? How do they react? There's a lot going on attached to the retina. The retina is a part of the nervous system, and it's linked with muscular systems, chemical systems, and eyesight systems. The peripheral nervous systems, which feed the central nervous systems, again show the interaction between external and internal systems. Posture, gait, balance is affected, neck position, all of those are connected to the eyes, and yet in a standard eye exam, they're not assessed. There's peripheral pathways, central pathways. When somebody has a blast injury or a concussion, they're going to react differently to retinal stimulation. The 20th century eye examinations are no longer sufficient for people, especially with the advent of interactive media and virtual reality. There's a problem even with posture. When you have a difference between the internal systems of proprioception and balance and the external systems of where you see things, how the person's posture is. There's shoulder problems, hip problems, knee problems, ankle problems that can all occur because of these imbalances. So reactions to changing the environment with glasses can be measured, and the amount and the direction of light that comes in can be altered. So the suggestions I have for the current testing is to add in the patient moving while you angle the light to the edges of each retina, to have the patient seated while more awareness is placed on location and size of the targets, and to balance between the right and left, as well as peripheral and central, as well as auditory and visual. There is a mind-eye connection. When you have somebody, the father is holding a child up, and the child perceives a completely different scenario, and the mother perceives an even different scenario. So even though you have the same thing in the external environment, their internal environments of whether they're panicky, whether they're happy, are different. Prescribing Mind-Eye Glasses requires only a few minutes of additional testing, and what it does for a military person or anybody is it improves situational awareness. It can make clearer decision-making, faster reaction time, and the effects of the lenses on brain activity can be categorized separately depending on patients' adaptations. Just because a patient is nearsighted does not mean that they have to see. There are people we see that they are worse than 20/20 and they're very happy, and there are other people who are 20/20 and they're very uncomfortable. That 20/20 is just not enough anymore. Other population samples can benefit from selectively placing light on the retina too, such as Alzheimer's disease, Parkinson's disease, speech deficits, motion sickness, among others. So again, because of the slide problem, we want to make sure that we met the objectives here. Moving targets and moving people should be a staple in military vision screenings. Having a person seated is just not enough. Glasses can calm the nervous system by altering the biochemistry in the retina, and then thus the biochemistry in the whole body. They can be used as an interface between the internal processing and the external world, and balance and posture. And I'm hoping that the objective of today to dispel the common misperception that 20/20 is all that is needed was met. Remember these key points. The peripheral retina is important and it's overlooked. Glasses can be used for people with 20/20. They can change much more than eyesight, and that there actually is a mind-eye connection. The following teammates are appreciated for their help in showing the diagnostic and therapeutic methods for the assessment and treatment here. Simon Keja, Steve Divick, Aliriza Ziai, and Corey Feinberg are today, and tomorrow's group will go into therapeutic methods. The basic theme of the whole ocular measurements is that the eye is a piece of the brain, and when you alter the eye, you're altering brain function, you're altering body function. And that 20/20 is the slowest pathway possible, and all these other peripheral pathways and internal pathways occur first before you aim and before you focus on anything. Thank you.